The Nigeria Center for Disease Control says 59 suspected and 15 confirmed cases of monkeypox have been recorded in the country. The Dallas County Health and Human Services in Texas, United States, had in July 16 reported a case of monkeypox in a resident who recently returned from Nigeria. Speaking on the development, Director General of the NCDC, Tuyi Mebawondu, said an outbreak will be declared when there is a large cluster of monkeypox cases. And he said, and I quote, the federal government was notified of the situation in Texas through the international health regulations, who reported a case of monkeypox disease diagnosed in a patient who had recently visited Nigeria. Mr. Mebawondu advised Nigerians that, quote, if they feel ill or have a sudden rash, they should please visit a hospital for diagnosis and management, end of quote. Monkeypox is caused by a virus closely related to that which causes smallpox and cowpox, although not as deadly as smallpox. It is spread via large respiratory droplets from someone showing symptoms of the disease and can also be transmitted by direct contact with bodily fluids or lesion material. People who are asymptomatic cannot spread the virus. That is the assumption. But we have an expert in the house to make us understand how all of these are, so we can prevent, and for those who have, so we can give them an idea and tips on how to manage. I have with me public health specialist Tuyi Mebawondu in the studio. It's nice to have you join me this morning.
Good morning, Mike.
Good to see you.
Yeah, nice to see you too.
Great. Now, there's a great concern with the rising cases of some of the confirmed cases of monkeypox in the country. What is this monkeypox all about? We're used to smallpox, but they're not talking about monkeypox. Talk to us about this.
2017, we witnessed the first case of monkeypox in Nigeria after a break of about 39 years. Okay, that means that for 39 years, we've not seen a single case of monkeypox. But from 2017 up to now, we've seen a smoldering kind of endemic monkeypox. And then if you look at the figures, as much as 466, close to 500 cases have been, diagnosed or throughout the time. In 2020, we had just 8 cases for the whole of the country. But already this year, within the first 6 months, we're having as much as 30 cases, which is actually showing that the thing is ticking up. Now, I had warned 3 years ago that we're going to see more of epidemics, and then we need to actually step up our surveillance in looking at those things that might come up in public space. Now, monkeypox, like you rightly said, a virus caused, similar to smallpox and cowpox. The key thing is that you get rashes. You pick it from animals, like I've always said here severally. This germ jumps from either a domesticated animal or a wild animal to a human, and then use human being to spread itself around. So when the rashes comes, of course, the prodromal stage, body ache, fever, and all these constitutional symptoms. Then later, the key factor, the key diagnostic issue is the rash. The rash starts from the face and spread around the body like the smallpox, right? Then the rash is bigger than that of smallpox. It forms, big, what we call papules, and then it gets raised up. Pus enter the thing, and then the thing bursts and causes scarring of the skin.
And causes a sore, kind of.
Yeah, it's kind of sore, yes. Sore and scarring of the skin. Of course, the fatality rate is very low. Maybe 1 in 10 of them will get. But again, like I warned 3-4 years ago, that the major issue is this. Supposing this virus mutates, what do we need to do? So it's important that for us, a virus that's not having a clear-cut treatment, that's not having vaccine to deal with it, that can spread from human to human, we should be careful and take requisite action to prevent the jump and the spread of the virus.
As the name implies, monkeypox, does it have any relation with monkeys directly?
Yes, because the cluster was first seen among monkeys, in the past, but not only monkeys that can transmit it. We saw other wild animals can transmit it, rodents, squirrels, some mice,
By a bite or by droplets?
Either through
by eating
contact with their fluid, with their fluid. Of course, you know that in some environments, those things are delicacies they're eating. And then, of course, contact with the fluid, with the body fluid of those animals can lead to the transmission of the virus from those animals to human. What we call a zoonotic spark, a jump, you know. So the key intervention should be that how do we pick this virus before it starts, and how do we stop it from spreading?
But as it is right now, is there any cure for the monkeypox?
There's no cure. No, like I said, the fertility rate is very low, 1 in 10. There's no cure. If people that are sick with monkeypox, they have to be treated symptomatically. You know, infection you treat, fever you treat, loss of body fluid you treat. That's what you do. No vaccine. Why? It has been said that the smallpox vaccine can actually work against it. But we've eradicated smallpox since 1980, so that's a long time ago. Who is having the smallpox vaccine now? And the challenge is that here we are, you know, in this country, epidemics keep breaking. We're still dealing with COVID, even a Delta variant. We're talking about Lambda variant of the COVID now. Today, we know that what's called cholera killed as many as 60 people, both in Jigawa and Yobe State. So we just have all these public health emergencies staring us in the face. What has happened is that it shows clearly that from 39 years before 2017, we've not been doing enough on our public health. We've not, honestly, because if we have a break of a virus for 39 years, and suddenly we now saw it coming up in 2017 and keep increasing in number, it shows that we've not been doing a lot on our public health. And that is a place we need to focus on, because we don't have the luxury, we don't have the necessary interventions that can deal with outbreak of any virus.
If we have to talk about really taking that action, what are we supposed to have done in practical terms, either from the side of the government or from the side of individuals?
The starting point, because let's be mindful, epidemic will increase. It's not going to decrease. You know, the factors are just clearly staring us in the faces, because one, we see a lot of humans getting interaction with these wild animals. We're felling trees, we're building residents, we're doing more farming. Nigeria is priority farming as their own.
So we're encroaching into their habitat.
Yeah, so again, we're not allowing those space for them. If we are doing that, what it means is that we have to increase our surveillance. We must be able to detect the virus before it starts and stop it from spreading. So what do? You have to, your agri-practice, you know, your veterinarians, you know, the public health people, the local people, you have to get them involved, you know, in actually spotting this virus before, you know, it starts spreading. You know, some of those animals have to be taken and samples checked. That means that you are talking about the quality of epidemiological laboratory in Nigeria. You need to train people that can do that. I'm talking about the level of government. I need to train people that can really do those epidemiological survey, that can pick and look around the community, have a system of reporting abnormal rash, for instance, abnormal illness, vomiting, unnecessary vomiting, and a cluster of those things to a central government. But again, look, it's a broken health system who reports nothing. Now, apart from that, at individual level, at the local level, that is public health education. That is the only thing you can deploy right now, because in the first instance, there are not enough health workers to go around the whole local area. Some of the parts of Nigeria is experiencing banditry and insurgency that makes it difficult for health people to really stay around and even worsen the spread of such epidemic. So government trying to spot before the thing, you know, starts, and government also trying to prevent the spread by educating the people, by stepping up their laboratories, by increasing epidemiological studies and survey of those things. And then we have to also keep it in public consciousness. The need to take up the public space as far as proper information is concerned cannot be overemphasized. So some of this mix of things there can help us to limit this kind of
How
circumstances.
bad is it for us right now as a country when we have some of these diseases coming back? Cholera, if you mentioned cholera earlier on, is coming back. We're receiving from the reports we're getting, it's surfacing in some of the states right now. We're having monkeypox back. Lassa fever is still there. River blindness and some of these tropical diseases that one would have thought, okay, we've forgotten and they are gone. Gradually, they're still there. And then it forms a kind of a complex. But as a country, how bad is it for us if we have to take a step to handle all of these things at the same time? Security is something else we won't even talk about right now, and so on, and the economy.
We tell you what, if you look, even for a lot of Nigerians that are so spiritual, it took a health catastrophe for even the so-called Pharaoh to release Israelites. Health is so central to so many things. Without health, you can't run your economy. Without health, you can't have population that you're proud of. Without health, you can't have foreign direct investment. Who do you think will come and say, okay, I'm going to invest in a country riddled by various endemic diseases, coronavirus here, monkeypox here, polio, good enough, we're not having polio again, Lassa fever here. So, it's bad both for us as a country, economically, security-wise, and even for the prosperity of the country. We must be able to tie these things together, but we're putting things in silos. What we're seeing in this Nigeria is that we're seeing, we're not seeing power of love, we're seeing love of power, which is not being deployed appropriately to address challenges, that has confronting us headlong. So now, here we are. Before you know it, a country can feel that in Nigeria, before you can enter our territory, go and do a test to confirm that you're not having monkeypox. What are you going to blame them? So we can't then be the source of spread of some rare diseases or some diseases that we think we should have consigned to the dustbin of history. So we need, honestly, to refocus on our health system. We need to. It is for our good. It is for the good of the nation. It's good for the security. It's good for the economy, and even the world will embrace us that these guys are on top of their health challenges.
All right. We thank you so much, Dr. Tuyi Mebawondu, for your insight into all of this. And I hope that all of us as a people and as a country will take steps towards preventing this from going forward. Thank you very much.
Thank you, Mike.
Thank you. Right.